even as the federal government was downplaying COVID, behind the scenes, there were organizations, including the American Medical Association, the American Academy of Pediatrics, the NAACP, different lawyers groups and even politicians were knowing that these racial disparities that exist in the United States that make Black people more vulnerable to serious illnesses and other people of color existed and were going to intersect with COVID in the worst kind of way. And so Black people are more likely to have the kinds of underlying conditions that make COVID more serious. And that just is a fact. And so when COVID came, it was what some people have called the perfect storm of terribleness, with people already with underlying conditions being hit with this really serious, confusing virus.
And can you talk about the distrust that African Americans have of the healthcare system and the historical context for that?
So we've known for, centuries, decades, years, that Black people and other people of color are treated unfairly in our current medical system. And how I think of it is, I don't think doctors and other healthcare providers go into medicine in order to do harm, but it happens because of mostly unconscious bias. And so it's been very well documented that Black people and other people of color, but specifically Black people, have unfair treatment, whether it's in pain management, whether it's in the emergency room, it's when getting C-sections, during birth, it's all kinds of different treatments where Black people just aren't treated well. So if there's a distrust, among Black people of the healthcare system, it's real and it's evidence-based that there is a problem, that people should be distrustful.
Speaking of history, I wanted to go to Nikole Hannah-Jones, who just won a Pulitzer Prize for her lead essay for the New York Times 1619 Project. She spoke to MTV last month about the racial disparities in COVID-related deaths.
What we're starting to see as we learn that Black people are disproportionately dying from this is this blaming of Black communities and saying that, well, that's just because Black people don't take care of themselves. Black people don't take care of their health. The truth is that Black people are living in a constructed environment that is designed to actually produce exactly the disparities that we see. It is not accidental that Black people are the most likely to live near toxic sites, the most likely to live in polluted neighborhoods, the most likely to live in areas where there's a lot of highway and freeway traffic. And so what that means is Black people have been intentionally placed in the most vulnerable positions.
That was Nikole Hannah-Jones. Linda Villarosa, you were a contributor to the acclaimed 1619 Project with an essay titled Myths About Physical Racial Differences Were Used to Justify Slavery and Are Still Believed by Doctors Today. As we wrap up, if you could comment on the significance of the 1619 Project that you were a part of, and also not only the Pulitzer going to Nikole Hannah-Jones, but to Ida B. Wells as well, in a special citation and award for her outstanding and courageous reporting on the horrific and vicious violence against African Americans during the era of lynching. If you can take us full circle.
Well, first of all, we are so proud of Nikole, and I was honored to be part of that project. And I think that it speaks to the power of Black women journalists, Nikole and Ida B. Wells, and I'm really proud to be a part of that group. I think that what 1619 did, the project, was take us back and look at the legacy of enslavement. And, there's always people saying, oh, slavery was so long ago. That's not part of our experience. But it is. And our charge was to prove that what happened during enslavement still lingers today.